The views and opinions expressed by guests on Soda City Unleashed are their own and do not necessarily reflect those of CVETS. While we love sharing stories and insights from the veterinary world, this podcast is for informational and entertainment purposes only. It is not a substitution for professional veterinary advice, diagnosis, or treatment. We always recommend consulting your primary veterinarian for any medical concerns regarding your pet. Welcome to Soda City Unleashed, where we decode pet health with some of the best vets and veterinary experts in Columbia, South Carolina. I'm your host, Emily White, and today we have one of CVET's incredible veterinarians, Dr. Erica Dunphy. How are you, Dr. Dunphy?
Good, how are you?
I am wonderful. Tell me about yourself and like where you went to school, where you're from, all that good stuff.
Oh boy. Okay. Well, I was born in New York, so I am a Yankee invading the South, as my new family calls that. I graduated from University of New England in Maine and went a month later into vet school.
Wow. In the Caribbean.
In the Caribbean, in a third world country. So I packed up, moved. I actually met Dr. Kent, who's in ER. We were both literally standing back to back on going through customs. And both of our parents were like, oh, do you see that girl? She's got a Rossfolder. You guys should be friends. We're like, Mom, we can make our own friends. Like, stop it. And now we've been friends ever since.
And
we
now
been
you
each
work
other's
together
weddings
too.
and
Wow.
we work together.
That's awesome.
So definitely some lifelong friendships from that one. But you do
Okay,
seven semesters there, and then you get placed in a clinical year within the United States. So I ended up at LSU. Go Tigers. The real ones. The true Death Valley. And I'll probably get shamed for this one. And then after my clinical year, I did a no-no and started dating an intern. So I followed him to UGA and I started at a band field there. And I worked there for about a year and a half. Decided to move with one of my friends. She was like, hey, just come live with me in Charlotte. And I was like, sweet, let's do that. So I moved to Charlotte. I started at a 6-doctor integrative practice. And then I was there for about 5 years. I met my husband, had my 2 daughters. And right before COVID, decided to move this way. And then had my son. And finally, Tracy was like, hey, we need somebody for rehab now, finally. And I was like, I will be there with bells on.
Okay, great. Well, tell me, you mentioned you started at a practice in Charlotte that was integrative. What does that mean exactly?
My boss at the time, she literally probably had a master's in TCVM, holistic medicine, food therapy, herbals, acupuncture. So I started to kind of lean in that direction. I actually got my veterinary chiropractic certification while I was there. We also had a rehab practitioner there. She was a human PT that then went and got her rehab certification for animals, and she was phenomenal. She could pick up things left and right that nobody else could find. So they had a treadmill there. We had laser, acupuncture. So I started figuring all of that out. Then that kind of put me where I am now. Because I was like, well, you get all these animals that have these chronic skin conditions, chronic arthritis. And it's like, okay, well, you're on all the meds that we have. And that's that. And it's like, okay, well, they're still not comfortable. Right. And it's between euthanasia or not. So I was like, there has to be something else that we can do to kind of make them better and have a better long quality of life.
After that, when you started there, you then went on and got certified in a lot of these things, right? What are all your different certifications?
It's a CVMMP, which is a Certified Veterinary Medical Manipulation Practitioner, which just sounds crazy.
Wow.
And then I did my CVA, which is Certified Veterinary Acupuncturist, and then just finished up the CCRP, which is a Certified Canine Rehab Practitioner.
Wow. All the letters. All the letters. Can you explain specifically what you do with all of this stuff at CVETS for people who might not even know that pet rehabilitation is a thing?
It's all dependent on the animal's needs, where they're at in their life. So class 4 laser that uses light energy basically to just help the body do its job better. So it kind of stimulates the mitochondria in the cells to start waking up and doing some more things with improving blood flow, releasing serotonin, natural opioids, just kind of helping the body heal itself in a non-invasive form. We have the hydrotherapy tank. That's just kind of generally a good support for getting them back to function, getting some buoyancy so that they're not having as much weight on their body. So kind of like when humans have knee replacements, they're like, go walk in a pool so that you can do the movement, but it's not as painful and can help strengthen your muscles.
So that's what we do with animals in the underwater treadmill.
And then the newest addition was the PulseVet Shockwave, which always incites some sort of dancing or something, which that has become probably one of my favorite therapy modalities. So that one's just a wee bit different, where it does sound waves. So your body's mostly water, and sound travels very far in water. So it can actually get deep into the body, into the bones, tendons, and helps kind of that similar thing, but in a much stronger fashion. So instead of coming in for every couple days for laser, this is kind of one of those things that you do one treatment and then maybe do another one in 2 weeks. So it's like 1 to 3 treatments 2 weeks apart is essentially the plan. But sometimes the pain relief can last up to 9 months.
Wow. And that's the one that's a little loud.
A little loud.
Yeah. You usually know when it's going on.
Yes. But we just got the little headphones too, like the ear protectors for the animals. Right. And it's probably one of my favorite things now. It's just super cute with Marco.
Yes, a really great photo of Marco. We'll have to put up on the screen here.
Yeah, he was not happy.
Yeah.
He was so mad.
And sometimes when you guys are doing that, you'll sedate the dogs a little bit too, right?
Yeah. A lot of times if they're going to be sedated, it's either like after they do a surgery, like the TPLOs, especially if they've both knees done, and it also makes the bone heal exponentially faster. It really does seem to help them recover a lot faster and help that bone to heal and get them weight bearing a lot faster too.
Right. What types of conditions or injuries do you most commonly treat with the patients that you see?
I do a lot with the sporting dogs. So I've recently been through a lot of tendinopathies.
What is that?
So and I was like, typically your sporting dogs. So we think about agility or fly ball, where they're doing turns and jumping up. I mean, fly ball, they're going over hurdles and they're running full speed into a platform, placing down, turning, and launching off in seconds. So these guys are really prone to shoulder, digits, wrist injuries, iliopsoas injuries, knee injuries. So, I mean, they're just athletes. But then I also see a lot of these older dogs that, again, are on a lot of pain management. And it's like, okay, well, things still aren't going well. Or they're coming in to see another service like oncology, and you just see them walk down the hall. And I'm like, oh my God, like you hurt me watching you walk. So trying to help them, even boost them through chemo with like acupuncture and herbals, just to help that process along. But then also making sure that while they're going through something that's really tough on their bodies, can we support them and kind of get them a better quality of life while they're also going through a tough time.
Right. I know a lot of times owners have to make the tough decision between surgery or treating at home, right? So a lot of times like down dogs, dogs who can't use their legs, a lot of times we recommend trying rehab. And I have seen personally stories of dogs who could not walk, could not use their back legs, and after working with you in rehab, can walk again. Mm-hmm. What does that feel like?
Oh, I mean, it's amazing. I was like, that's why we do it. Is that, I mean, obviously there's proof in the pudding at that point. Mm-hmm. Like, okay, what I'm doing actually is helping and making sense.
I think what's fun too, just from experience, the underwater treadmill has
so cute.
Like it's clear glass, right, on the side, so you're able to see everything that's going on. And when you see that back paw just like flip, and they're able to like put a little bit, like move it a little bit.
I'm like, okay, we're getting there.
Wonderful
it's happening.
Feeling.
Yeah. And I was like, it's just so cute, especially the little dogs, because there's like an inch of water in their little feet.
Because it's even doing anything. But what is the funniest or quirkiest thing an animal has done while in the underwater treadmill?
We have a Frenchie that had surgery. He had IVDD. He is absolutely crazy, and Mom knows he is too. So, I mean, we've had times where we have those little lick mats that we put the baby food on, and if we don't keep the closet closed, he'll go in and grab the entire packet of them, run them over to the bed. We have to use the squeaky balls that you guys, that Santa brought. I mean, he's been like under the water. I'm like, oh my God, this dog's gonna get aspiration pneumonia, and he's never, knock on wood, we've never had any issues, but he is insane. Like, I have videos of him. We're just laughing the whole time because he just looks crazy. People in the lobby are laughing because he's just hanging on.
Not your typical.
He's just hanging on to this toy for dear sweet life. Or he'll just dive in the water to get it. And I'm like, oh my gosh, please no. We're not doing this today. And then I think the other one recently too was yet another Frenchie. But he gargoyle noises in the treadmill for the whole time because that's not his favorite part. His favorite part is laser. So as soon as he gets out, he goes over to his bed, and I was like, Mom, I had pictures of him the other day, and he was just like before he had laser, like had total like just mad face, and then afterwards he was like, ah, and he was literally like laying on his side. He was also having a little extra bowel movements per se, so he treated his abdomen with laser, and I mean he's like sprawled out for it, and Kaylee started putting the laser away, and he was barking at her. He was like yelling at her like, no,
bring
ma'am,
bring it back,
bring my laser back. And every time now he's just so bossy about it. He's like, it's not done yet, like you still have so much more to do. And I was like, you don't need a laser beam your entire body. But he is very particular about it, and now it's getting very bossy.
They're so smart. They know what they like and don't like.
Oh, I mean, yeah, he likes that.
Do you remember Kenji?
Oh my gosh,
he was in the treadmill.
He was also one of my favorites.
He would just he would see his mom, and he'd be like,
oh, I mean, he would bark the whole time in there, and
I was the most unique bark.
He was
like a whine.
It was perfect. I was like, I even made him a little shirt when he graduated out of rehab. I had King Kenji.
Yes,
I was like this little T-shirt. Yeah. So he was one of my favorites.
Okay, so what are some signs that a pet owner might see that they might need to look into some rehab for their dog or their cat?
I think it's just kind of, are they like slow to get up in the morning? Like they get up and it's just kind of like really stiff. Or they're just not as active as they once were. If their appetite's a little wonky, sometimes that can be like a subtle sign of, hey, I'm a little bit uncomfortable today. But I mean, even just doing some normal things throughout the day. I know some people don't believe in the rehab or doing those kind of certain activities and exercises, but I mean, they're just like us. They need to have some sort of a plan in line to make sure that they're working the proper muscles, especially with dogs that are prone to back issues. Strengthening the core is super huge to also then support your back, which is the same in humans.
That's what something Dr. Bond says. She says with dogs that are prone to back issues is we don't want them not moving their back. We definitely want them doing things and making sure that the spine is moving and whatnot, but not like we don't necessarily want them jumping off of the counter onto the ground.
No, but I was like, and that's the hard part too. It's like dogs are going to be dogs. And I mean, you're going to leave the house and they're going to go parkour and you're not going to know that they're doing it. I mean, even if you have cameras on them, they're still going to parkour. You're going to yell at them through it, but they're still doing it. No, they're still going to do what they're going to do, but just trying to support them to help them prevent injuries versus like, okay, well now they're injured, now what?
Right.
So there
proactive. What are some of those things that people can do at home? I saw on TikTok, which is probably your worst nightmare, is
it's better than Google.
TikTok. Okay. But where someone people will like stretch their dogs out, they'll grab them by their hind legs and just kind of like stretch them. Is that something we should be doing?
I mean, it can be. I just wouldn't want to tweak the spine out of its normal plane of motion, so probably making sure you're doing it in a correct fashion. So what are some
safe things people could do?
So I was like, I've had some where if they've had like really tight hips, I mean, if they don't mind being on their back, but then at least you're kind of putting them in between your legs and you can do it that way.
Okay.
So at least you're supporting. But I mean, there's a lot of like stabilizing exercises, like if they're eating their dinner, having them like with a foot on a step or something along those lines. It'll work the hind legs, your glutes, hamstrings, quads, and core. So even having them eat, unless they have an issue that they can't eat that way. But I was like, we'll have like those little like balance discs, or even just putting them on a couch cushion or a pillow. Like those things are core exercises and kind of help with like that stability. But I was like, I can always make something if if we need to, just for kind of like routine. But I was like, a lot of the exercises after surgery or even from a medical perspective are really small things, like making sure your joints and limbs are moving. And a lot of it is helping like core stability.
That makes so much sense. My dog, you're very familiar with this. He likes to get on top of the couch cushion.
Yeah, they're cats. Cats in a dog body. Yes.
Yes. Maybe that helps his core a little bit, because he's definitely fallen off before. So
but I mean, that any unstable surfaces, I'm like, if you can even just have them on like a cushion, like anything unstable is going to do fine motor movements and kind of help with your core stabilization.
How would you say veterinary rehabilitation is evolving? Like when I started at CVETS, had no veterinary background. and saw you putting needles in a dog, I was like, what is going on? Acupuncture is a thing. I'm sure people don't know about the chiropractic part of it, the herbals.
Yep.
Tell me how the field is evolving and what new treatments or technologies excite you the most.
I've over time have figured out like there's a time and a place when you need like conventional medications. Like you're not going to be able to avoid that. But I think it's just trying to figure out the ways to help the conventional medicine work better and more effectively with minimal side effects. So I think that trying to find that good in between where, yes, you, again, time and a place for having a conventional medication. Like if your dog has pneumonia or a horrible UTI or these other things, yes, we need to fix those.
Right.
But there's also the portion where you can then add in an integrative option with doing like acupuncture, laser, adding in an herbal or a supplement to just kind of help those medications work better. And I think that's kind of the nice thing, having all of us in one room, basically, is that, okay, you can do your part, I can do my part, but the both together are going to help benefit each patient in their own unique way, because I don't treat everybody the same. It's a very individualized plan based on needs, expectations, and kind of how the dog will be able to tolerate whatever I'm doing.
So a lot of times I'll catch you in all the different departments talking to different doctors about their patients and what exactly you think that they need as far as integrative medicine goes and working together for a plan. It's not one size fits all by any means.
No. And I was like, if they're in there for medicine for some sort of like liver thing, but then they also have joint issues, it's like, okay, well, I would love to use like a carprofen or something to help with that, but that's not going to be good for the liver. So it's like, okay, well, now we need to find an option that would potentially be safe for liver and not add any insult to injury, basically. So then it's like, all right, well, then we can do laser. We can also do these different supplements, like herbal wise too, like liver support. So depending on each dog, again, is very different. We can add in something to help with that. And I was like, I have a cardio patient. I've been seeing her for many, many, many years, where she also has kidney issues. So that's the very delicate balance. And cardio is, okay, well, I need to make sure you don't have fluid buildup, but I also, that's going to injure your kidneys in the long run. So it's trying to find that balance. But I was like, she's had changes in her kidneys, but they haven't really gotten any worse at all because of the herbal support and acupuncture. So, I mean, we're way beyond any expectations that were kind of laid out in the beginning.
Wow.
So I was like, that's basically what you want. You have to have both to get to where you're supposed to be.
Absolutely. Wow. Some of the newer kind of exciting stuff that you're using, I think personally, is the Alpha Flow.
Oh God, yes.
Will you tell me about Alpha Flow?
So I was brought onto it by, she was actually one of my clients, again, now friend, but she, has agility dogs, but she was like, hey, have you heard of this? And I was like, no, what is this? She's like, oh, it's essentially like a stem cell derivative. And I was like, interesting. They harvest the placentas and cord blood, which they have to put through a filtering process because it's a really gross, dark greenish brown color, and nobody wants that to be injected into their body.
And they're from animals.
Correct.
Okay.
So it's, from the cord blood and placentas of baby puppies that have been born. They've all been screened for any infectious diseases, and they basically put it through a filtering process, and it makes these really potent anti-inflammatories. There's interleukins, there's tissue growth factors, angiogenic factors, and it'll actually, instead of putting fibrocartilage, which is more of like a scar tissue cartilage, it'll make new hyaline cartilage, which is way better for longevity and kind of that management in the joints. So I was like, okay, well, let's see how this goes. And I reached out to the company, and they're like, here, we're just going to send you some vials to just play with it. Let me know how it goes. If you have any like medical, like, okay, I tore my ligament in my knee. I have an ACL tear, but we don't want to go through with surgery. Let's try that. So I had one that I did that on, and it's been almost a year now, and I have not seen her back, and she has not been limping since.
Wow.
So I was like, all right, well, there's that. That's a cool one. And then we had Whaley. had horrible wounds, ended up getting a really resistant infection. And I mean, her original wound was like this big in between her shoulder blades, and she had one about that big on her elbow. So we had like a 2 ml vial, and I was like, hey, Dr. LaFlock and DeMello, do you guys just take it, inject it, see what happens. Mom was tired of doing surgeries because she had 3 or 4 of them, I think. So we just injected around the margins of the wound, and I was like, it was insane. Nothing else was done after that, and she was able to not have any other procedures. It's antibacterial, it's antifungal, so you can technically use it in a septic infected joint, and it'll actually help that process. But I think I'm up to like 65, maybe 70 injections that I've done since we've gotten the product. I think it's way better than PRP, personally. They don't have to be under full anesthesia. You just sedate them, pull it out of the freezer, thaw it, inject it. Usually their lameness is gone in 3 to 7 days.
Wow.
Fairly consistently. I've done it on a couple post-op TPLOs, my dog and one of my friends that introduced me to it, and he was literally weight-bearing that night. So that's why we're doing the TPLO study with them to see, like, okay, is there a difference in their return to function? Are they going to be walking the next day? Then also, is that bone going to heal faster? And then also kind of down the road, is it going to help prevent that arthritis formation? Is that going to be something that's going to be a game changer for these surgical cases?
Well, I'm super interested to hear how your Alpha Flow study goes with the TPLOs.
Oh, yeah.
So
I was like, I've been nothing but impressed.
Okay, a couple more questions. Do you have, out of all your fun tools and gadgets, do you have a favorite that you love using in rehab?
The Shockwave is definitely my new fan favorite because, I mean, it's quick, it's fast, it's very effective. And it's fun. And it's fun to just dance to when you're sitting there. I was like...
It makes a wonderful beat for those.
I was like, we just need to do like the drumline solo now.
Yeah, great.
We'll be ready to go.
What is the most unusual patient you've ever worked with?
So in Charlotte... I also had 2 doctors there that did exotics. So, I mean, we've had everything under the sun. We had a fox. She's had skunks. We had a baby emu that had weird little legs that they had to, like, splint so that it didn't. I was like, there's an emu in here. A snake that ate a golf ball. She did surgery on it, popped it out.
Oh, my
God. And I was like, this is the most rewarding thing I've ever seen. Just like, bloop, bloop, and plops it out. And I was like, the snake's still kind of moving. Is that okay? She's like, yeah, it's fine. I was like, okay, I'm leaving now. Yeah, I was like, I'm good. I'm going to leave now. And she'd fix all the broken turtles, like literally screws and wire. She would fix all the shells. And I was like, this is super cool. Not that I wanted to do it, but it was cool to watch. But there was one day she was going to be out and she's like, hey, there's an opossum that's going to come in tomorrow. And it has a really big wound on its tail. So all you have to do is just laser it and then rebandage it. And I was like, oh, okay. So how do I get said possum to sit still so I can laser it and bandage it? And she's like, just bring a banana. And I was like, what? Okay, well, I'll bring a banana. And so I came in, I was like, hey, I was Dr. Johnson then. So I was like, hey, I'm Dr. Johnson. I was like, I was doing this for Dr. Laura, if that's okay. And she's like, oh yeah, sure. I was like, I was told to bring a banana. And she's like, okay, great. So I like peel this banana and I give it to the possum and we take off the bandage and he's just sitting there with his little hands, just nomming on this banana. Didn't have a care in the world. Lasered him, put some SSD cream on, rebandaged his tail, happy as a clam.
And he's just eating his
banana. And he was just eating his banana the whole time. And I was like, I really thought you were joking. Like I was genuinely like this wild possum's good, but he was very tame and they just were at a wildlife rescue.
What do you say? Are they good boys? Like, good boy.
I was like, you did great.
You're doing great.
Please don't bite me. You have very sharp teeth and little tiny feet.
Enjoy
and he
your
was just
banana.
like sitting there like, no. And I was like, this is the cutest thing I've ever seen, but also didn't think that was real life.
Random.
So random.
Wow.
But I was like, I guess, sure. Yeah. I can.
Anything you need?
Anything you need, I guess. She's like, it's fine. Just make sure you have a banana. And I was like, okay.
We have touched this in a myriad of ways, but what would you say is the most rewarding part of your job?
Oh, I think it's doing the kind of impossible that this wouldn't have happened in any other way. Especially, I think it's more on like the neuro side of things. And even some of these older patients where it was like, I didn't think they would be able to go play with their toys again. And literally after this treatment, they're running, they're doing things that they haven't done in years. So it was seeing that you can help in a way that they actually enjoyed doing it. Or being a part of the therapy, because yes, I bribe by love with baby food meats and snacks, and I'll go bring in canned baby food like applesauces if they can't have meat or whatever snacks that they want. I will 100% bribe my love, and there's a lot of them that will not work without food. So I was like, I feel that too. So
I get it.
I will make sure I have her snacks.
Okay, I have a couple rapid fire questions. Ready?
Oh God.
Dogs or cats?
Dog.
Favorite breed to work with in rehab?
I think I really do actually like the cat sometimes, but I was like, honestly, Bacon's probably my favorite cat.
Okay.
He's like a 15-year-old kitty cat, and he walked in the treadmill, and he was on that churro, like he's like,
I'll be in this water.
Cutest one ever. But I like the chilled ones.
Okay.
But I also laugh at the crazy ones. So I mean, there's
all of the above.
All of the above.
Underwater treadmill or laser therapy?
Underwater treadmill.
Okay. Favorite guilty pleasure snack at work?
I have a whole closet of snacks, but I was like, we have like chocolate up there, and everyone's like, can I come steal snacks from your office? And I was like, it's not stealing if you're asking me. Yes, you can go have any chocolate or snacks that are up there. Go help yourself. Are you sure? Yes. Go, please eat it so I don't.
That's really sweet.
Yes, I know. Mm-hmm.
Okay, best pet name you've ever heard?
I had a Bacon Harry cheeseburger. The last name was Burger.
That's genius.
I know. I
love that.
I would have had so many. Bacon I also like the really punny ones too.
Okay.
I was like, I think it was a cardio patient, the Tequila Mockingbird.
Oh, that's a beautiful cat.
I love that one.
I love that one
too.
I
was like, that is genius.
My favorite a cat as well, Baja Blast.
Oh, that's a good one too.
I'll never forget that cat.
I also like them when they have human names like Kevin,
Yes.
Steve.
Yes, love a Bob.
Yes, Bob is a good one too.
It's a good one.
Wellington.
Actually met a dog named Emily today.
Oh, that's good. Mm-hmm. I did name Maisie after a dog. A lot of dogs actually. I had like 3 or 4 Maisies at one time. My child, yes. My firstborn was named Maisie. I had a border collie named Maisie that was spelt like the Maisie, and I was like, that's a really cute little name. And then they saw him with like Z's or the Y's. I was like, I don't like those. And my husband's like, then they're gonna think she's Macy. And I was like, no. I was like, it's Maisie. And then he was like, this is my firstborn. This is Maisie. She's named after a dog. And I was like, don't say it like that. Like, this border collie is perfect and beautiful. And like, look at her. Like,
it's an honor to be named
Maisie. Leave me alone.
Okay, go to hype song before a busy day.
Oh, I don't even know like the name of it. Also, I'm really into this K-pop now. Ooh. That K-pop Demon Hunters movie is like on point. So
I've heard that floating around the internet.
Yeah, just the soundtrack is fantastic.
Okay, so that's what we're into now?
Yeah, I was like, Mick likes the Soda Pop song, so he always requests that on the way to school. And then there's the Golden song is Maddie's favorite, and then I think Takedown. Maisie's really aggressive lately, so she likes that one too. But all the songs are amazing. Like,
is it a kids movie?
It technically is, but literally Calfee was humming it the other day when we were working in ER, and I was like, "Are you singing K-pop right now?" And she's like, "I watched it 3 times this weekend."
K-pop Demon Hunters. All right.
I was like, I'm telling you, it's very catchy.
If you could add a new therapy tool tomorrow to your stash of tools, what would it be?
Probably I like a therapeutic ultrasound.
Ooh.
It's
Dr. Mike, are you listening to this podcast?
Yeah, no. I don't need anything else. The shockwave was more than enough. No more.
Wait. No. It's fine. Yeah. Awesome. Well, thank you so much for being on the podcast.
Absolutely.
We've been waiting for you to sit in this seat. So glad you were able to make it. And thank you.
Absolutely.
Yeah.
Anytime.
All right. Well, until next time, give your pet an extra pet from us. And thank you for joining us for Soda City Unleashed.